Good morning. I'm sure you've been in the car most of the morning. On a typical Duluth, cool, sunny day. All right, there are going to be a lot of people talking to you today. I have a quick takeaway message. Students who are still sitting here today and parents, the takeaway message is if you students think you're sick, you think your roommate's sick, you think the new friend you made down the hall is sick, come to health service. Parents, if your student calls you and you can't quite tell what's going on, you're feeling kind of bad being 150 miles away, you're used to taking care of your student, you tell them, go to health service. Those are the words you need to remember, go to health service. You're going to be charged what's called a health fee every semester, and those are the monies that we use to have health service up and running. It allows us to pay the staff. It allows us to lay in a whole bunch of different kinds of supplies. So those are the words you need to remember. Now, if you want to sleep through the rest of the presentation, you can, but you've got the words you need to know. Go to health service. Even though students are really looking forward to leaving home and going off to school, it really is one of the biggest adjustments that they're probably ever going to have to make in their lives. They are going to have to get used to living in one small room with somebody when maybe they're used to having their own room. They're going to have to share a bathroom down the hall with an awful lot of people. They're going to have to make all the decisions that they think are going to be fun to make, but they're used to maybe talking over with you or maybe having you make for them, and it's exhausting. Add on to that the fact that they've spent the last 3 weeks before they've come to school staying out late, saying goodbye to everybody who they know, staying up late the last 3 nights at their home, packing everything they're sure they're going to need, and by the time they get here on that move-in day that Jean was just talking about, by Tuesday morning, after move-in weekend, when health service opens up, there's generally a line down the hall, and they're wondering where health service has been all weekend. So we generally start with a bang on that Tuesday morning with a lot of kids already sick. I've thought, I'm sure you can't see this from where you're sitting, I thought we should have t-shirts printed to wear on that Tuesday morning and really periodically throughout the semester that should say, if it hurts to pee, come see me. My supervisor thought it was tacky. He said no. I don't get it. I think it's brilliant, really, but he disagreed. Who we are, health services run, the full-time staff is RNs. We have part-time nurse practitioners. We're at a point between 3, 4, 5 different part-time nurse practitioners. Right now we have 3 part-time family nurse practitioners and 1 part-time psychiatric nurse practitioner. This past year, 3 of them have been also on the faculty in the nursing program, either in the undergrad or the graduate nursing program. 1 has been employed off campus. And that staff is always in a little bit of a state of flux depending upon their other responsibilities, their teaching schedules, whatever. And that is no different this year. The people who are going to be working in health service is a little bit in flux at the moment. We also work with counseling. Health service is part of a larger department known as Schwab, Student Center for Health and Well-Being. So it's health service and counseling. Counseling is physically located in this building in Tower Hall. Health service is physically located in the ground floor of Summers. If you haven't had a tour yet, it's on the same lower level as the Greenview Dining Room. My guess is that probably is where you're going to have lunch today. Health service is kind of on the opposite end of the lower level of Summers, and it might seem like it's kind of difficult to find, but I promise you that your students will know where we are. Probably by Christmas they will be familiar with health service and probably know some of us by first name. You can check with the folks in the green shirts, the students who are working orientation, and my guess is that most of them are very familiar with health service and would define us as friends. Statistically, it shows that we see all years of students pretty much equally. We feel like we get to know the first-year students better than we know anybody else, and part of that we think is just about access, because first-year students generally live in a dorm, and it's so handy. They come down in their pajamas and their slippers. They wake up in the morning and they have a sore throat, and within about 5 minutes they're in our office wanting a strep test. And it's that easy for them. It's a little bit trickier for the people who live in Kirst, which is the farthest apartment building out there. In the dead of winter, they really have to bundle up and make an effort to get to health service. But the statistics show that we see, as I say, every year of student equally, and they do learn that they pay for the service and get pretty familiar and comfortable knowing us and using us, and that sort of is what we strive to provide to them. Who can use us? Anybody who's a full-time student, and that means anybody who takes 9 credits or more is automatically charged that health service fee that, as I say, is what allows us to lay in a supply of Dayquil, Robitussin DM cough syrup, cough drops, throat lozenges, Claritin, Benadryl, you name it. I have 2 huge cupboards of over-the-counter medicine and another cupboard full of prescription medicines that the nurse practitioners can prescribe and use, as well as crutches and ACE bandages and Band-Aids and Steri-strips and you name it. We've got it. What we do, we're sort of an odd combination of mom, the medicine cabinet, the family doctor, and urgent care, if such a thing is possible. I think that probably is a fairly good description. We don't do x-ray, and we don't have full service lab available immediately in health service, but we can draw and send to St. Mary's any lab that the nurse practitioners want, and that lab can be available to us the same day. So we can offer full spectrum lab testing. Anybody who we're concerned has broken a bone, and that does happen, we do send to urgent care. We can send somebody off to get an x-ray, but if it's broken, they have to be seen someplace else for casting anyway. So we do use urgent care for those situations. As I say, we work quite closely and well with the counselors because we're part of the same department. We use the same electronic medical record, and so we work quite well together. We do have an arrangement to use some services of a couple of the physical therapists on campus, and they will do for us something called an evaluation. They can't do ongoing physical therapy, let's just say, and I'll have to tell you that I'm continually amazed by how many young people, students in the 18 to 22-year-old age group, have had numerous orthopedic procedures or need orthopedic procedures and then need sort of, I don't know that I want to say ongoing, but they need significant physical therapy. The physical therapists who work with us can't do that physical therapy that goes on for a month or 2, but let's just say, for instance, I'm thinking of a student who was, an off-campus student who was walking her dog. The dog saw a squirrel, took off, and the student's shoulder was, let's just say, messed up for lack of a better term. Orthopedic stuff can be sort of difficult as RNs to figure out, so because of this relationship we have with a couple of the physical therapists, they would do an evaluation for us. So we send the student over to see the physical therapist. They do their little magic and tell us what, if anything, needs to happen. They have amazing skill at getting people in to be seen by orthopedics if that's what needs to happen. And we use them quite a bit, and it's an amazing service. They get the evaluation free. We pay them a piddly amount, which they're happy with, and the student gets a fabulous evaluation, and they get a referral if that's what they need for evaluation by an orthopedist. And We can provide really good orthopedic care to students if that's what they need. We are able to loan out crutches. We do have a wheelchair to loan out for, as I say, students who have orthopedic procedures and need to get around in a wheelchair for a period of time. We do that fairly often. Let's see, I'm down to HIPAA, and you will find that HIPAA will drive you absolutely crazy because your students are, I'm guessing, all 18 years old. And so their health information is personal and private, and what you will find is that you get to pay for their health care, you just don't get to know about it. And I know because I've been through this 3 times, and that's not exactly true, because if we have their permission to speak to you, we certainly can. But the basic rule is that we can't speak to you unless we have their express written permission to do so. Insurance, a lot, and I would even say most of what happens in health service is at no charge. Let's just go back to the example of the student who wakes up in the morning and their throat is sore and they come down to health service in their slippers and pajamas to see one of the RNs, and we look at them and do a strep test. That's all at no charge. To see the RN and to have any of the lab that we do in health service. And the lab tests that we do in health service are strep, mono, we do urine dipsticks, pregnancy tests, blood sugar, hemoglobin. They're all what are called CLIA waived lab tests, and CLIA waived lab tests are, I've always described them as tests that you could train a monkey to do. That's what they'll let us do. Anything more complex than that, we need an order for, and that gets sent to St. Mary's, and as I say, we get those results either the same day or by the next morning. They're sitting on our fax machine and waiting for us. And when I said that anything more complex we need an order for, let's just say your student's throat looks terrible and the strep is negative and they have big glands, and so we do a mono and the mono is negative and their tonsils are huge and I'm concerned about that. I would, and we are attempting this year to have a nurse practitioner in health service at some point, either morning or afternoon every day. My decision would be to have the nurse practitioner take a look at your student, because I'd be concerned that that was somebody sicker than I should decide is okay if their strep and mono were negative and their tonsils were that huge. So I would slate them in to see the nurse practitioner. If your student sees the nurse practitioner, that visit will get charged to your insurance. So my advice to you is going to be to make a copy of the front and back of your health insurance card and send it with your student, so that we have that information if they see the nurse practitioner. The other thing I'm going to suggest you do is to take a half an hour this summer, call your insurance, tell them that your student is going to school in Duluth, the College of St. Scholastica, and is your insurance going to cover visits at the health service? We are on the provider list for Blue Cross Blue Shield, Health Partners, and Medica, and I think by the fall we'll be on the list for Preferred One as well. I can tell you that if your insurance denies the visit charge, it will be written off. If they say that the charge goes to your deductible, we have to charge that. We didn't for a while, and then we found out that was fraud, and my boss decided that he really wasn't all that fond of prison. So deductible denied. I think that's about it. Lab charges we can't write off, because if they are things that we don't do in health service, like I say, if my nurse practitioner wants just a strep and mono, we'll just do what we have in health service and there'll be no charge for that. But if we do a throat culture, if we do a white count and diff, if we do thyroid, I'm trying to think of what some of the common things are that we send out. Those are actually the common ones. We send those to St. Mary's, and St. Mary's bills us for those. The bill they send to us is a fraction of the charges that you're used to seeing on bills that you get from your healthcare provider. because they are our reference lab. And so I would say they are a third of what you are used to seeing. We're not in the business of making money, we're just in the business of paying that bill. And so you can expect that that's what you will see from us as well. We just need to get that bill paid. So that's what we charge. It's just what it costs us to get that bill paid. And we'll bill that charge to your insurance as well and hope that that gets paid. But make a call to your insurance. We have had people find out that their insurance won't pay anything for their student to be seen at health service. But they'll pay, for example, at Mount Royal Medical Center, which is a clinic of family doctors on the other side of UMD. It's a St. Luke's clinic, or for instance, they'd pay at St. Mary's Hospital, and sometimes it's difficult for people to find that out until their kids have had a visit in health service, and we can work that out for people if we know that. So sometimes if you just make that phone call and know what the rules are, and your student knows what the rules are, we can help them with that. I found out the same thing with one of my daughters at the University of North Dakota. She got sick, and I uttered those famous words, "Go to health service." And I ended up with a charge from the health service. They gave her a Z-Pak, which if I'd sent her to Altru, it would have been paid by my insurance. I'm still fine with it. I think it was the right thing to do. But, live and learn. I'm supposed to know the ins and outs, and still didn't know how to make it work. So let me tell you, it's complicated, and it'll probably frustrate you. And being the professional, I didn't know how to make it work for my own child. So there's a bit of a learning curve to this insurance stuff. So do send a copy of your insurance card with your student. We talked a little bit about what's charged and what's not. All the RN stuff in the on-campus lab at no charge. To see the NP in any lab that gets sent to St. Mary's is what will be charged to insurance, and immunization. We offer MMRs, Gardasil, the HPV vaccine, Tdap, varicella, hepatitis B, hepatitis A vaccines, and they are all charged to insurance, and I can promise you that we have those and are happy to give those to your student. We give a lot of Tdap vaccine because all of the health science majors, the nurses, OTs, PTs, and exercise phys majors all have to have a Tdap vaccine, and one that's been around since 2005, not one that they had in their primary series when they were babies, in order to do their clinical work. And so we have those, and we give a lot of them, so I've got them, but I can't promise you that your insurance will pay me to give it. So, but keep in mind that by the time your child jumps in the car and drives all the way to the cities of southern Minnesota or wherever in Wisconsin that you live and gets the shot and drives back, they've probably paid more in gas than it would have cost for me to just give them the shot and you to pay for it. So keep that in mind as well when you're making decisions about how to work that stuff out. We're still able to give any student who wants an influenza vaccine one at no charge. I was happy to hear Pam when she was up here introducing everyone. She talked a little bit about a session late this afternoon where they're going to talk about fees, and she mentioned insurance and waiving it. Another thing about insurance is that the school has a policy that they offer. It's sort of fondly known as schools insurance. Some people are of the impression that we have found this fabulous plan, and if we offer it to you, it must be amazing, and you should really think seriously about putting your student on it. And really nothing could be farther from the truth. The college has a policy that students should have some kind of insurance. So they have found a plan that is very affordable, like in the $1,000 a year range. It's an illness and injury only plan, meaning that it will cover absolutely nothing related to wellness. So it won't cover the cost of a physical. It'll cover no immunization. If your student has any medications that they use for acne, if they have a health condition like diabetes, epilepsy, it will cover nothing related to those medications. It will cover a broken leg, cover medicine for a strep throat. Illness and injury is what it covers. So it can get students by. We fill in the gaps with the wellness stuff by covering those visits at no charge in health service. But it really is a policy that will just get you by if your student has no other option for insurance. I do recommend that you keep your student on your family policy if you have a fairly decent policy and it has some coverage that's available in Duluth. Some people find that they change their student's primary care provider to a clinic in Duluth during the period of time they're in school here. Apparently that's a relatively easy thing to do. You can change it like within a month. If that's something you think you want to do, let me know. I can help you find a place to change it to if you want to do that. On that same vein, if your student has some sort of a health condition and you want them set up with, let's just say, a subspecialist, a gastroenterologist, an endocrinologist, there are two complete systems in town. There's the St. Mary's system, now known as Essentia. There's the St. Luke's system, and they're both complete systems, and they both provide wonderful care. And we can help you if you are trying to find some place for your student to have a doctor in case they need one. Just talk to me afterwards, or you can call anytime, night or day, and leave a message on the health service phone. There's somebody in sort of sporadically through the summer to check the phone messages, and someone will get back to you about that over the summer if you leave a message. Additionally, we find that there are students who are under the care of a doctor and they need lab work, for example. People with thyroid conditions who need to have their lab work checked. They don't necessarily have to see the doctor, but they have to have their lab checked. And so what we found is that students have to miss class on Friday. They jump in their car, they drive all the way home just to get their lab work checked. And so what might be important for you to know is that if we have just lab orders from the doctor, all they have to be is faxed to our fax number. We can draw that lab work, get the results, fax the lab work back to the doctor, and oftentimes that care can be done without the student ever having to leave school. It's saved a lot of kids a lot of missed class, a lot of gas money. So if they don't actually have to see the doctor face to face, we can absolutely work that out. I absolutely recommend the meningitis vaccine. When I started talking about meningitis a handful of years ago, the vaccine was pretty new and a lot of people couldn't get the vaccine. My guess is that a lot of you have had the vaccine, maybe even at that 7th grade physical. I would check your child's immunization records and see whether or not they've had that. I wouldn't let my own kids step foot in their freshman dorm without that vaccine. There's a small but statistically significant increased risk to dorm-dwelling freshmen. My life before being a college health nurse, I did work in an ICU and took care of somebody who had meningococcal meningitis, and it was awful. And that was enough for me to know that that meningitis vaccine was important. As I say, I think in this day and age, your students have probably all been immunized, but I would check and make sure. If your student hasn't been immunized, if you don't have access to that vaccine, that's another one of those phone calls you can make. Leave your student's name on the health service answering machine. Even if you think of it at midnight, just call. They answer the phone here 24 hours a day. You don't even have to know health services number. It's the great thing about a small college. Call the campus operator, ask them to connect you to health service. Just wait through the long summer message and leave your name, leave your student's name, and I promise you that we'll bother your student relentlessly in the fall until they come down and get that meningitis vaccine. I meant for this piece of paper to go in the parent folder, but it did end up in the student folder. I did put in a piece of paper suggesting some things that you could put in one of those 99-cent like plastic shoe boxes that you can buy at like Walgreens or Target to make a first aid kit, because not unlike your life with your student, they do have a tendency to get sick at night and on the weekend when health service is closed. It's simple things for, colds, sore throats, but I made a list of things that are commonly used that might keep them happy at night and on the weekend when they get sick. In addition to the things that go in there, they do also have access to something called an online self-care guide that is specifically designed for the things that generally happen to college students. It's fabulous, and we absolutely love it. We think it gives really excellent advice. Tells them exactly what to do if they've got, belly pain, sore throat, whatever. It's a fabulous resource, and it's available on the Health Service website. We have a philosophy of trying to treat students like we would expect any health service where our own children go to school to be treated. And backed by popular demand will be cute Band-Aids and a decent piece of candy if you don't cry when you come to health service. Anybody with questions? I often get questions about prescription medications, actually in a number of different ways. One, do we have prescription medications? And I have often said that we have a couple of antibiotics in health service, but just yesterday I was busy getting ready to reorder supplies. Man, we probably had 15 prescription medications that we keep, and I don't know how it escaped my notice before that we had quite so many, but we have amoxicillin and Cipro and Keflex and Bactrim, and we actually have quite a handful of medications. We have diflucan and metronidazole, and we have quite a handful that we keep in that cupboard, and if those happen to be the medicines that students need, they're provided at no charge. So we really do make taking care of students pretty handy and easy. Now let's just say, for example, your student has a strep throat and they're allergic to penicillin, then they will have to be written a prescription, let's say, for example, for a Z-Pak, and we don't carry that one in health service more than anything because it just costs too much for us to give to them at no charge. The nearest pharmacy is now a Walgreens, and it is the very first store in the Kenwood Shopping Center, which is just a couple blocks up the street. That particular Walgreens doesn't deliver, but there is another Walgreens that does. So we generally find it takes about a week or two for students to find someone with a car who will give them a ride. But if they're just too sick to wander out to get this, we can call the prescription to the Walgreens that delivers, and they honestly will deliver it basically to the student's door. So that can be arranged. Any other question? Oh, come on. You'll probably think of it the minute I walk out the door, or when you jump in the car and head for home, or if you're like me at 2:30 in the morning. Don't hesitate to pick up the phone and call and leave that message on the answering machine. I will be happy to get back to you. Yes, go ahead.
What are your hours?
That's a good one. We've tried a handful of different hours, and this next year we're going to try, once again, different hours, and they're going to be 9 to 5, Monday through Friday. But during your students' time here, they'll probably change again. We tried some evening hours till 7 in the evening, thinking that would work, but they weren't very popular, so we scaled it back. Anybody else? All right, thank you.